Hi, I'm Lisa Hall and this is Dr. Cypher, and we're here today to discuss some of the services that he does in his practice and how chiropractic pertains to wellness.
Chiropractic has to do with the nervous system, the innate ability of the body to heal without the use of drugs or surgery. The nerves run the show. What happens is if the nervous system becomes imbalanced, you get sick. And so what we do with our hands and other methods is to balance the nervous system so you, the patient, does the healing and get well. Okay, yeah, what the person can expect would be a history and a physical exam. And the physical exam entails the nervous system, of course. We check the nerves, the muscles, and the reflexes. And after a thorough battery of exams, we might do an x-ray, we might do an MRI, we might do some imaging. But then usually we do some form of treatment to reduce some of the muscle spasm, pain, and swelling. Typically patients will come in with one of those components. No, actually, it feels like a pop and a release and a relief. Most people experience a dramatic improvement of the range of motion. No, the answer to your question is absolutely not. How often, or if you get the benefit of chiropractic care, is really up to you. It's your health, it's your response, your nervous system. Oftentimes people, it's kind of creatures of habit, they'll wait until it gets too bad. It's like a dentist, they wait until the teeth is raging, and then it's a matter of doing something about it. But yeah, no, we offer treatment plans, different treatment plans to help them help themselves. But you don't have to come for the rest of your life. We'll do a brief clinical trial, 6 to 12 sessions, and then re-examine their need. But some people do understand the value of the nervous system of chiropractic care, and they choose to get chiropractic care from time to time. Graduated in 1984, and I started practice immediately. Mostly orthopedics and neurology, as well as rehabilitation. We've seen an awful lot of injury patients, people who are pecking away at their computers all day, a lot of repetitive stress injury, but we see our fair share of trauma as well. I do, yeah, whether it's the weekend warrior athlete or the high school athlete or the college athlete. Yeah, we're seeing an awful lot more injuries to the knees, and for soccer players in particular. So any time where there's an injury to the spine, we would triage them, we would do a history exam of them and imaging studies to see whether we could treat them directly or refer them if necessary. I think experience would be the first thing that comes in mind. I think I've seen thousands of patients over the last 30 years. I think ultimately it's the trusting relationship that I have with the patients over the years. Most of my patients come from other satisfied patients, So I think the experience, as well as the personal care, I think that we deliver, it's a lot different than just being the number or being like so much cattle being prodded through some of the other doctors' offices. I think we get the patients in right away. There's no waiting list here. So I think just overall, and then my co-workers here at the office are outstanding. We just really make the patients feel at home and respect them. I do, yeah. On an informed basis, we'll do the exam. 80% of the patients who come in really do need the chiropractic care. There's maybe another 10% that I co-manage, and a very small percent actually need surgery. In terms of awards, I was the chiropractic doctor of the year back in 2006. I was written up in Washingtonian magazine. And I think it's important to know that I've had 4 children, at least my wife had. And we've together raised 4 nice boys despite all the stresses of practice and whatnot,